Jerry Brown here with Jerry Brown Travels.
Lori here.
In this video, we're going to be talking about Mexico healthcare and what it's all about. There's a lot of material that we're covering in this video. Hang in there because I know it will bring you value and you'll appreciate it. We want to help you and to understand the different choices you have if you decide to move to Mexico. So, Lori, I know you're not going to stick around. Where are you going to go right now?
Well, you know what? I have the idea. I'm going to go cook my Cambodia food.
Okay. Okay. Thanks, Lori. Well, in this video, we're going to talk about two aspects of Mexican insurance that you can qualify here for. Now, the first one is private medical care. What do I mean by that? I mean by using the private hospitals, the private clinics that are available here in Mexico. It's very simple in a lot of ways, and it's very reasonable priced. The next phase, what we'll look at in this video, we're going to talk about the private medical insurance and what you can expect by having them. So when you're traveling, you could get and use rather the private medical care. You could go to a local clinic. Let's say you needed some stitches, or you needed, something that really wasn't severe. You could walk in and you can get that emergency taken care of. Could you do me a favor? Could you hit the like button? That's the one with the thumbs up. And how about subscribing? I would appreciate that. Also, leave a comment. Anything that you would like, I will then present that to you when I answer your questions on YouTube. Now, the private hospitals and clinics are exceptional. They're very clean. As an example, I was in the hospital a few years ago, and I had a 4-day stay there, and it was $4,000. In the United States, that probably would be about $12,000 and up. So the private hospitals are very clean. The equipment is up to date. The other thing that's really great about the private care here is they're fast. It's very convenient. You can go in, especially if you're in a larger area. Now, let's say that you need a specialist. You need to, maybe you're experiencing high blood pressure, dizziness, stuff like that. So you'd like to maybe see a cardiologist, so a specialist. And so, again, you can walk into the hospital. It's not an emergency situation. You can let the front desk know what you want. They will then set you up with a doctor. The doctor then will give you a review, and he'll look at what you need. You may need to get some testing done. They can do that right in the hospital. And so he can diagnose it right away for you. And for a specialist here, it's probably going to cost you in US dollars between $35 for a visit to $50 for a visit here. Let me give you an example. I was in a private hospital for a hernia operation. They did it laparoscopically. I told them that I did not eat meat. And so they brought up from the cafeteria, they brought up the head lady that organizes the cafeteria. She created a menu for me that was more towards vegetarian. And I wasn't, after this surgery, I was feeling a little queasy, and I stayed another day. I asked my doctor, can I stay another day? And he said, sure. And it was like about $80 to stay another day. No problem. So I felt real good about that. That gives you an idea how reasonable prices are down here. Now, there are different levels of private hospitals and clinics here. And so some of the hospitals are cheaper. And a lot of times what the doctor will do, if he's thinking about admitting you to a private hospital, he'll ask you, basically, what care do you want? And so because you can pay different levels there, and they are very sensitive about what budgets are and how much people have to spend for it. And then they can make a recommendation for you. And it depends. Of course, if you're going to have heart surgery, something severe like that, you'd want to choose the very best one. But if it's something like a hernia operation that's sort of routine, you really don't need to spend that money for the extra one. You get a middle grade hospital here that will take care of you. So another convenient service down here is to use these little clinics that are usually attached to a pharmacy. And you can walk in. A lot of times they will actually have posted what their costs are. And that also is important. Whoever you talk to, if you need medical care, ask them what the prices are. Get a quote from them. That's very important. And then you may even say, well, how much is it at this hospital versus this hospital? That way you'll be clear on what your costs are. But the little clinics that are attached to the pharmacies, they're great because, again, especially if you're a tourist and you need, you have an upset stomach or something like that, you can go in and he can prescribe or she can prescribe a medicine for you. You can go into the pharmacy there and get it. So take advantage of those little clinics because they're very convenient, little services for you at a very reasonable price. Well, what they will charge you in those little clinics is anywhere from $10 to $15 to get a consultation and maybe a prescription. Talking about prescriptions, well, here in Mexico, if you come down and you're taking a medication and bring a bottle of your medicine, you actually can take a photograph of it and you can go into a pharmacy and get your medication filled here. You don't have to go to a doctor for your typical medications. So it's very easy to refill your medication here. Now, if you need some type of like a sleeping tablet or something like that, they're not going to give that to you. You would need to go to a doctor and get a prescription there. Very easy to renew your medicines down here. Now let's talk about MRIs. A friend of ours just came back from having an MRI. Well, the consultation with the doctor was $40. That was a specialist. And the actual cost of the MRI was $540. And in the United States, you'd be probably looking at $4,000 for that same MRI. So it gives you an idea of the difference in prices down here. A lot of times people will come down to Mexico because they do want reasonable medical care, even if they have insurance back in the States. And so as an example, what's quite popular here is knee replacement surgery. And you can figure here in Mexico, the range is anywhere from maybe $3,000 to $5,000 for a knee replacement. And so you can then understand what this price is here, and you can check your area and see what they would charge you there. So maybe it's worth an air flight down here, seeing the specialist, and then getting the operation done down here. And the neat thing about it is that it's fairly quickly. They'll move you right along fairly quickly. You don't have to wait too long. So if you're in a lot of pain, that is very important to you, to have the surgery done right away. Like anything, you want to get another opinion and another price quote. You may even want to get 3 opinions on that, and then weigh out the factors of what you want to do. Do you want to do the surgery here? If it's an emergency situation, can you wait to go back to your own country? Like if you're from the United States and you have Medicare, it may be better to go back to the United States and use the Medicare system. So you can check out what it is. If you live here and you still collect Medicare, well, sometimes by the time you figure your flight in, your hotel in, all of those things, it may be cheaper to get it here. And then you can, convalesce, you can get well in your own home in a comfortable environment with having the hassle of using the Medicare system in the United States. Okay, now let's talk about private medical insurance that you pay for to qualify. First of all, I want to let you know that if you have any pre-existing conditions, you can't get private medical insurance here in Mexico. They're very strict on that. But the private medical insurance, there's a lot, like any medical insurance, there's a lot of different levels of what you want, how much coverage you want on different things. So what we need to do is you need to come into an area that you want to stay in, you want to live in, and you make an appointment maybe with 3 different insurance companies and talk to them and go over what each one of those are and how much they are costing you monthly or annually. And then also you then will weigh out the facts of what you're going to get for that amount of money. Generally speaking, is that for a premium that you'll be paying, it could be anywhere from $80 a month to $200 a month. Of course, as you get older, it goes up in price. So the younger you are, you'll get a better deal on that. One of the other things that you can do, you're not sure you really want to live in Mexico, okay? And you want to come down and you want to check out all these things. You want to know before you come down what these services are and what they'll cost. You don't even need to have the problem. You can make a visit with a doctor and talk to them about prices. Talk to them about the care of the different hospitals and what you can expect. So what you would do, let's say you're coming down for 6 months, just get travel insurance while you're here, and that'll cover emergencies. That'll give you time to do the research, because it does take a little bit of time to figure out all the different scenarios, especially if you really want to save some money. So take the time, get travel insurance, and then you're not in a big rush. You won't make the wrong choice. Another thing that you can do, let's say you thought, well, why do I need to come to Mexico and do that? Well, there's 2 facts if you want to do that. Is one, you'll see if Mexico is right for you, and then you can do the research. You may have visited, let's say, Puerto Vallarta or Cancun, but you want to live in San Miguel Allende. And so you can then go there and do the research. Now, you don't have to come here. You can do it online from wherever you are in your living room, in the comfort of your own home. Go online, look for these things, Google the stuff, and then do your due diligence online, and that could save you a lot of time. Other things, if there's certain medication that is very specific and very specialized, you want to make sure that they have that medication down here. So by calling a doctor, getting a consultation over the phone, and they'll do that with you, and then you can ask them about the medications. You want to come down, and you want to take your time. You want to do your due diligence. You want to know about it, so this way there aren't any surprises. Well, I hope this has clarified some of the stuff. It's a big subject, and there's a lot to understand about it. So I have a link down below with Valerie that is with Blue Angels, and you can actually call her and ask her these questions. That's the way you can do your due diligence from your home and get her opinion and what you would need to qualify and how much it would be. So I want to say thank you very much. Make a comment, give me feedback, what you want to hear, want me to make videos, and also, again, please subscribe, give me a thumbs up, and I'd appreciate that.